This is a demonstration of the Pulse for Good feedback system, particularly paying attention to how it could be used in a behavioral health setting. You'll notice on your screen a simple survey. This survey can be ran on any internet-connected device. It also runs on the Pulse for Good kiosks. You can imagine walking up to it and interacting with your fingers. You can say, "How was your visit?" How was your visit? And I can come in and say, my visit was not good to very good, or somewhere in between. I'm going to say my visit was pretty well. How safe did you feel at the fill in the blank? Add your facility name at the end there. How safe did you feel at whatever facility you're talking about? And I can come in and answer somewhere between these stars. Now, the Pulse for Good system provides a way for you to be able to do some complex logical paths for surveys. So if I answer high on this star ranking, you're going to be able to just move to the next question. If I answer low, I can serve up additional questions to try and understand why people didn't feel safe. For instance, I literally can get a question of why did I not feel safe? Now, this is obviously optional. I could say staff mistreated me. Move on. And then I get a question of how clean was it? All these questions are customizable. You can ask any types of questions, anything you want, as long as it's anonymous. And you can create as many complex logical paths as you want. So I could answer low here and get different questions based off of cleanliness. I could do just an additional follow-up question like you saw for safety, or I could do a bunch of questions. They could be fill in the blank, they could be star questions, they could be multi-choice, multi-select, or otherwise. As we move forward, I can show you all the different types of questions we ask. We commonly ask how clean a facility was, how nice the staff were, how safe people felt, and their overall experience. Then as we come in here, you can see what did you use? Well, I used various things. I could say use showers, maybe a computer, maybe clothing. This is set up for something akin to a homeless day center where they have multiple services. You can imagine under a behavioral health setting of either the staff members they interacted with, the type of therapies that they're using, whatever it may be. This is an example of multi-select. Again, you could do custom questions off of these. If they select showers, you could then ask some questions about showers. You don't have to, however. They can also skip this question and just go next. Then we get some qualitative questions. You can ask as many as you want of these as well. We recommend things like, what do you wish was here? What would make the difference for you? What else do you wish you, what else would you like to tell us? What else should we have asked? A lot of those questions can bring out some of the best responses in people. You notice as we fill out these questions down here that it explains how far along we are in the survey. We recommend keeping the surveys from somewhere between 10 and 12 questions, and we track the drop-off in questions because you imagine as people fill this out at a kiosk, they can walk away at any time. And as they can walk away, we need to make sure that the kiosk resets itself to be ready for the next person. And so as we hang out here, it'll take a minute or so, you'll be able to see a little prompt that will come up to say, hey, are you still interested in the survey? Are you still thinking? Are you still taking time? At that point, I can hit continue, where it will say, okay, great, you can continue to take the survey and it'll give me some more time. Or I can hit restart and restart the survey. If I don't do anything and that red bar gets all the way to the end, it's going to restart the survey for me. I'm going to hit the continue and just keep walking us through. At any point, if I want to restart the survey, I can come up here and hit the restart button, or I can change the languages up here. You can have any one of 210 different languages that Google supports to its translate. That means we translate those questions for you automatically. I can ask demographic questions. So again, imagine this as something like a safe haven or a homeless shelter, where somebody's going to answer how long they've been homeless. You could ask whatever you'd like demographically. The real question is, how do you want to be able to splice up your data? I can ask what their ethnicity is. I can ask how old someone is. I can ask what their gender is. And obviously we have male, female, and transgender here. We also can do male, female, transgender other, or male, female, transgender other, transitioning male to female, or transitioning female to male. It can be whatever you'd like it to be. You can ask what your marital status is. You can ask a number of different things. Then at the end, you can provide a custom message for your clientele. It could even be a link to an additional survey if you'd like to do that, if they'd like to take some. By default, we remind people to wash their hands as they've just interacted with a kiosk. And to help prevent the spread of COVID, we want to make sure that everybody washes their hands whenever they're using something that's high touch. When the person hits finish, it relaunches the survey back into the next survey for the next person. Now you may ask, what's to prevent someone from doing this? I'm just gonna spam these real quick, and you just get a whole bunch of 1-star responses. Well, what prevents it is our spam check ability. And what that does is it times the amount of time it took you to answer questions in the survey. And by taking the time, we can tell how much time you took to be able to actually think about and answer this question. And there's a certain amount of time that is literally too little for you to be able to read and comprehend the question and be able to give an honest answer. And so when somebody's answering that fast, we exclude those scores from the conversation and from your data. Now, talking about the data, let's try and head back to that. The data itself is automatically put into a dashboard for us to be able to look at. This is the dashboard for the survey that we just took. You'll notice a few things right off the bat. First, these filters at the top. This is filtering on time. I'm just seeing responses for this month, for things that have happened in this month. You can see overall, my score is at a 4.04. That's trending up compared to last month, which was a 3.28. So you can see my 4 stars. I've had 19 reviews. 19 people have taken this survey this month, and you can see the outlay of who took them at what times. You can see each question, star question, broken down here. How was your visit? How safe did you feel? How clean was it? How nice were the staff? With their associated last month's scores to compare and see if they're trending up or down. You can look at the data in a chart form. So this is by week, and each of these connects to one of these. So I can see, let's just look at safety here. I can see safety is trending, it's actually staying right around 4 stars, kind of average there. You can see this over longer time spans as well, and I'll look at that in a second. You can see the answers to the qualitative questions here. What do you not feel safe? It was dark. What do you wish was here? A trampoline. Kind of silly answers, but you'll get some awesome ones and some interesting ones. And then a breakdown of all of the responses on pie chart form. Now, there's some fun things we can do with this data. First of all, let's look at a little more data. So we're going to look at all-time responses, and you'll see them start trending more. Now, by week is a little intense when you get to that point, so let me go over to month, and you can see some trends where we're moving up or down. You can also see how frequently responses are putting in here, and you get a lot more information. Now that I have this much information, I may want to slice it up and compare. So if I come in here and try and say, okay, let's look at how someone who is white says this system is doing. Right? So for those that are white, they report a 4.09 compared to the 3-point-something overall that we had. That's interesting. Now let's come in and try and look and see maybe what someone that is black or African American is saying in the system. Right? So they report a 3.75, which may point out some cause for concern when those that are self-identifying as white report a higher score than those that identify as black. There's a good chance there's something happening in your system that isn't providing equal outcomes for everybody. And it's a really good indicator that you should spend some more time looking at these and try and figure it out. Now, there's all types of filters I could apply here. I could come in and say, I want to see people who are white, under 18, and use showers. And search for it. And there was a single person that took it, and they had a great experience matching that. If I just say white and under 18, I only have 3 people in this regard. You can play with these filters and do a bunch of different things and be able to find out what populations are you underserving. And based off of that, you can implement improvements to be able to create a more equal and equitable solutions for your clients at your behavioral health and mental health facilities. On top of all of these, you have the ability, this is where I control language, I can do it in my survey, I can share this information with people. I can share the dashboard access to various groups, so you can give them guest access, they can come in and look at it. I can print these reports, and these printed reports can then go on and be used in various things like sent to boards or other groups that may need them, or to meet regulatory requirements. I can download all of this data, either via CSV or API, and so I could be constantly pulling this data into another charting system or into another dashboard if I happen to have needs for more dashboards. And I can add more users to the system if I just want to add more admins or more people who are able to see all this data and play with it as much as we want. Finally, And I will pull over really quickly. What we found is that many executives don't have time to be able to look at data all the time. To be able to be in these dashboards, that's kind of hard. So what we've done is we've created fancy email reports that get sent out every week. So here is Valley Behavioral Health. They're one of the Pulse for Good providers. They're a fairly big organization. They have multiple kiosks, and so I'm only subscribed to one kiosk, but I'll get an email each week that shows me how they were doing. So this was their overall as an organization. They had 136 responses this week. That's up from the last week before. And then the one kiosk or survey that I'm assigned to was Tooele, and I can see how that one in particular is doing. And so if I had multiple, I could see multiple down here. I can also see the qualitative answers that are being answered. This gives a very good at-a-glance understanding of what's going on in my organization, so I don't have to necessarily take a look at the data tools that are being given to me. This was an overview of the Pulse for Good system, particularly for behavioral health providers. I hope it's helpful, and I hope this triggers some desires to be able to gather feedback in an automated way.